Hey everybody, this is another video from the series Your Question, My Answer. In this video, someone asked me, "Hello doctor, quote, can I ask you about CHF heart failure? They said the cause of CHF is lack of thiamine. Is that true? Please reply and thank you." Then, and what is the good vitamins for CHF? I took a high dose of diuretics and make my heart beat low. Please let me know what the best to take. Thank you very much. So unquote. So this is somebody. She's asking that somebody told her that thiamine deficiency can cause heart failure, and what are the good vitamins to take if you have diagnosis of heart failure. Thank you for asking all this important question. It's really fascinating. So this is a very important question. Congestive heart failure is not usually caused by lack of thiamine alone, and that too in America. Um, in some poor third world countries, there may be a deficiency of thiamine and vitamin B1, and that can cause a rare type of heart failure called wet beriberi. Okay, severe thiamine deficiency can cause a rare type of heart failure called wet beriberi. So WETBERIBERI. The most common causes of CHF are coronary artery disease, where the heart arteries are blocked, long-standing high blood pressure, means blood pressure has not been controlled, there have been damage to cardiac muscles, diabetes, prior heart attack where muscles have been damaged, valve problem like aortic stenosis, aortic regurgitation, mitral stenosis, mitral regurgitation, etc., cardiomyopathy. Now, so vitamin B1 deficiency in severe cases can cause wet beriberi. It's common if there is a severe malnutrition, chronic alcohol use, and long-term high dose of diuretic use. So yes, thiamine deficiency can contribute to, in certain cases. It's not the main cause of the most of people with CHF. Now, coming to the second question, what vitamins are helpful in CHF? Vitamins' roles are supportive. They do not replace prescribed medication for your heart failure.